Hello and welcome to the New Jersey Morning Show. I'm Dina DeLisa Gonser in for Cara DeFalco.
And I'm Mike Favetta. Thanks for joining us this morning. New Jersey is under a drought warning as firefighters battle wildfires across our state. How can these fires impact our health, though? Joining us today is Dr. Eric Costanzo, the Director of Medical Intensive Care at Hackensack Meridian Jersey Shore University Medical Center. Dr. Costanzo, thank you so much for taking the time to speak with us.
Oh, you're very welcome. Thank you.
So first, can you help us understand why wildfires, even if they're not happening directly in our community, can still have a serious impact on air quality here in New Jersey?
Yeah, absolutely. Unfortunately, we're a little too familiar with this based on the Canadian wildfire situation, which really goes a long way in really letting you know what the environmental impact can have in terms of wind shear, and where the different fronts are pushing the plumes of smoke. So really, these impacts are far-reaching, depending on what the weather pattern is, and I think it goes a long way to really heeding warnings both near the fire and far, and really listening to you guys in terms of the air quality and what the weather and wind looks like, because that really has far-reaching implications, as evidenced by last summer's wildfires in Canada.
Yes, and we've seen in recent air quality advisories, smoke can affect the air we breathe, even on days when we're not necessarily smelling it. Can you explain how particulate matter in the air affects our respiratory health?
Absolutely. I mean, when you look at scientifically the particulate size and different microns, the smaller the particle, the easier it is to penetrate into the lung tissue. That's kind of, the reason why we use meter dose inhalers, right, for asthma and COPD, because we have the right particulate size of the medication delivery system to get deep in the lungs. So these tiny particles, which you may or may not smell, can get into the lungs and really initiate a cascade of inflammatory responses that lead to consequences like coughing and wheezing, and feeling short of breath. So it's not only the air quality, but it's the particulate matter in the air from the wildfires that penetrate into the lung and cause inflammation.
And we've heard so much about those with respiratory issues, chronic diseases, the elderly, the young, that are at most risk due to the poor air quality. What symptoms should these people look out for, and are there any others, that fall into those high-risk categories?
Sure. I think that the symptoms really almost begin as allergic type symptoms: itchy eyes, maybe feeling a little lightheaded or congested in the upper airway in your nasal passages, and then progressing to a dry mouth, and then coughing and feeling short of breath or having chest heaviness. I think those particularly susceptible are patients with emphysema, COPD, and asthma. However, healthy individuals often uh, engaging in endurance activities outside certainly are at a risk as well. The earliest, I mean, I think it's very simple. Heed your warning signs, right? If you don't feel right, if your eyes feel a little bit itchy or irritated, then that's a warning sign that something downstream, meaning in your lungs, might be getting irritated and inflamed as well. So I think we keep it simple here. And if you feel uncomfortable in the upper airway areas, then I think it's a warning sign that maybe the air quality isn't such to support outside activity.
So we've talked about some of the symptoms that people can watch out for to recognize that they're starting to suffer from some type of respiratory distress. So now, could you outline some of the main precautions we could take when the air quality is poor?
Absolutely, that's an excellent question, and I think heeding caution is always the best option. I think it starts most importantly with listening to you guys, following the weather pattern, seeing which way the wind's going, getting an air quality report. Once you have the air quality report and you know what the weather's going to look like for the day, if you have existing lung disease and you have a high, poor air quality, it's best to avoid outside activities almost completely. And if you need to go outside, it's best to wear a mask. And if you have no underlying lung disease, I would heed the same warning. I limit outside activity. If you exercise outside, go to the gym. If you need to participate in any activities outside, I would wear a mask. But I think really it's a two-part process: paying attention to the weather and paying attention to your body for early warning signs.
Now, Dr. Costanzo, comparing this recent trend of smoky days that we've had in New Jersey compared to last year when there were 1 or 2 days each season that had some bad smoke, we've seen this much more frequently. So, do you see a long term issue with maybe more frequent visits to a doctor or a hospital for those sensitive groups, just due to the fact that there are so many more numerous days where the air quality is poor?
I think, given the string of consecutive days of poor air quality, patients specifically with pre-existing lung conditions, I do expect to see an uptick in office visits. We have not seen an uptick in the emergency room as of yet. And again, I think that may or may not come. But I think what we're seeing and experiencing in the office setting is a little bit more um, propensity to have exacerbations of underlying lung disease, as in asthma exacerbations and COPD. So I think you're 100% correct. The more days we string together with smoke and poor air quality, I think this will be proportional to the number of visits we see in our office, and hopefully not the emergency rooms. But we're not. Obviously, we need some rain, so we'll have to wait and see.
Right, and of course that rain would be would help this the issue and kind of nip the bud on the head. Tell us when those people who have the underlying issues are starting to experience symptoms. At what point do they need to seek medical help and come see you?
I think those patients that have these conditions are very much aware of when they're running into trouble or feeling chest tightness or an inability to get air in, as they say often. I think that really the easiest thing is if you find you're using your rescue inhaler. I think when a pulmonologist, as I am, creates a care plan for a patient with existing lung disease, there's maintenance medicines and emergency rescue medicine, like albuterol. And if you're using the emergency rescue medicine a little more frequently than you have, that really is a sign that maybe you want to reach out to your pulmonary physician and get ahead of it, because once you have this irritation and inflammation, it does have a cascading effect in the lungs and your total body health.
Well, thank you for your medical expertise, Dr. Eric Costanzo, Director of the Medical Intensive Care at Hackensack Meridian Jersey Shore University Medical Center. We appreciate your time.
And thank you for having me.
Oh man, these wildfires really creating a bit of a situation for everyone across
Right.
the board.
Yeah, as
Um,
if people getting sick just from the weather turning cold and warm one
exactly.
day to the next isn't enough.
I know. Well, really hoping it rectifies itself soon. We're looking at that weather, Mike.
We are.
Well, coming up, we had a Target run that just got a little bit more interesting for some shoppers. A celebrity superstar spotted in Clifton.